Good morning, everyone. Welcome to the Utah School Mental Health Collaborative 8-part learning series. As some of you all may know, we do present once a month, and every single month we bring you a different topic that is actually critical to our school mental health frameworks. So we have a team today from the UTech Lab that houses the Utah School Mental Health Collaborative, and we are a technology in training, education, and consultation lab housed within the College of Educational Psychology at the University of Utah. So let's take a minute to go around and introduce our collaborative team, and I can go first and we can pass around. So my name is Chitrala Peruma Wood. I'm a postdoctoral fellow, and I'm also a consultant in the Utah School Mental Health Collaborative project.
I'm Derek Smith. I'm a staff psychologist with the lab, and I do a consulting project.
I'm Molly Davis. I'm a clinical social worker and supervisor in the UTech Lab.
And I'm Jocelyn Kazarikodama, and I am the project development assistant.
Wonderful. Thank you all. So first, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from our funders and also our collaborators. So we have Cambia Health Solutions, the Huntsman Mental Health Institute, ULEAD from the Utah State Board of Education, and also Utah State University. So the content for today's training was developed by the Mental Health Technology Transfer Center Network, we also call MHTTC, and also the National Center for School Mental Health. So the MHTTC network hosted an 8-part learning series or a training series using the National School Mental Health Best Practices, implementation guidance modules for states, districts, and schools. This resource was developed by the MHTTC network in partnership with the National Center for School Mental Health. And really it aims to help states, districts, and schools advance comprehensive school mental health and engage in a planning process for implementation of that work. The primary intended audience for this series is districts, school teams, and community behavioral health providers who really help not only to develop, but also oversee school mental health systems, may it be class-wide, building-wide, and also school-wide. So right here, what you see is the guidance modules, and it includes a trainer and a participant manual. It also includes 8 sets of slide decks for each of the modules in the curriculum, representing and talking about the core features of comprehensive school mental health. If you are interested in this curriculum, I'm going to put the link to the form in the chat. Please go ahead and sign up for it. But if you also want, you can refer to the flyer that we sent you all about this training, and you can also access the participant manual through that. So you can see here the 8 modules that make up the implementation guide. And in this series, so far, we have covered foundations of comprehensive school mental health, teaming, needs assessment, and resource mapping, and screening. If you did not have a chance to attend any of these sessions, you can find all of the recordings to all of these sessions on our Utah School Mental Health Collaborative website. So that way you won't miss a thing and you can always catch up. So today we will quickly recap mental health promotion within schools and talk about some best practices when trying to implement them. And in the months to come, we will review these other topics that are listed here: early intervention and treatment, funding and sustainability, and then finally impact. So we have around 3 months left to complete this whole series. So before we get started, a really quick disclaimer: the opinions expressed in this learning session are the views of the presenters and do not reflect the official position of the Department of Health and Human Services, or SAMHSA, or the MHTTC network and the National Center for School Mental Health. There is no official support or endorsement of the HHS, SAMHSA, or opinions described in this document is intended or should be inferred. So what I'm going to do now is we can kind of switch gears, and for a few minutes, I'm just going to share some of the highlights from this module as a refresher. But I do want to remind you that the full module recording is available and again can be accessed through the flyer that we shared with you previously. So this title is, this module is titled Mental Health Promotion for All and how we can implement some of these practices in our schools. If you are already implementing these, that's wonderful to hear, but we'll also talk about how you can assess and reassess and improve the future. So this is our very brief agenda for today, but there's tons to talk about. So we'll kind of go through the definitions of mental health promotion. We'll talk about why we need to promote mental health in our schools and also talk about some quality indicators and best practices when implementing these Tier 1 services. So what is mental health promotion? I'll give you a couple of seconds to read through this definition, and then I'll walk you through it. So what is mental health promotion? So mental health promotion is also called Tier 1 services. And these are activities that schools do to foster positive social, emotional, and behavioral skills, and also well-being of all students, no matter if they're at risk or you feel that they're at risk, or or anticipate any kind of risk that may come their way. So you want to include all students and consider their mental health. Now, here you have on the bottom 6 most commonly delivered Tier 1 mental health services and supports. And the critical piece of Tier 1 is that these supports are provided universally to all students in schools. So meaning to all individuals in schools, meaning students and staff. And when you say all, I think we kind of want to include all of like our entire school, right? And this is accurate, and actually this is where we want to be. But realistically, I have mentioned in previous presentations, schools are actually in different places in terms of resources. And in that case, schools can begin with implementing Tier 1 practices on a very small scale. So think about all of the children in a grade, all of the children in a classroom, and then you can kind of improve to include all of the students in your school. So it's always good to start small because it can be really overwhelming to think about trying to include all of the students in one go. So I just want to emphasize that continuously in all of my presentations. So again, right here are like very 6 commonly delivered Tier 1 services in school. So we have school climate, teacher and school staff well-being, positive behaviors and relationships, positive discipline practices, and we'll kind of go through the difference between those, mental health literacy, and social emotional learning. So now we know the definition of mental health promotion, but why do we need mental health promotion in schools? Why do we need this compared to the more one-on-one or group interventions that we provide to students? So I'll give you again a couple of seconds to skim through this slide, and then I'll walk you through it. So mental health promotion is designed to reach all students. Like I mentioned before, all can be the whole school, a certain grade if that's where you want to focus, or a certain classroom if that's where you want to focus. But when we do include all students, we include those who are at risk and those who have high risk factors that could potentially put these children at greater risk for developing mental health concerns in the future. So investing in mental health promotion, if you think about it, results in cost savings because it does reduce and eliminate the need for more kind of the intensive and acute services that are more costly. So what you can do is through these Tier 1 practices, schools can identify students who are at risk way early in the process and be able to provide kind of the timely support than, identifying them later on and then having to provide these more acute and intense, for example, crisis supports, ER services, and inpatient treatments. So mental health promotion efforts really also decrease the stigma about mental health and illness, and also promote well-being for both students and staff. And this is important because the Tier 1 services kind of takes a more strengths-based approach. So you are always talking about mental health in positive terminology and positive perspective. And with that, the Tier 1 services are kind of being more promotion focused, and also it aims to increase mental health awareness within the community, students and staff, because the more positively you want to talk about things, the less likely people are to avoid those conversations. So the other thing is, when we do talk about mental health promotion, we say all individuals, and that goes to say we also want to include the mental health and wellness of our school staff, because educators play a key role in the day-to-day functioning of schools and also of our students. And I think it's really important to think about mental health as a part of overall health. And in that kind of like equation, it's typically, if you talk about the stigma or like the hesitation to talk about mental health is not considered a part of overall health. It's kind of, people are very likely to gravitate towards overall health kind of only includes physical health. So it's important to have this mindset of mental health is a part of overall health. And that plays a big role in how our students learn, how our teachers function, and how our overall school system functions. So this resource right here, the School Mental Health Quality Guide, it has a chapter or a section on mental health promotion services and supports. And I am going to put the link on the chat to this resource. And if you do have the time, I would encourage you to obtain this guide right here, because it really nicely lays out the background and why you need to do more Tier 1 supports. What are some best practices, different examples from the field, some action steps, and also tons of really great and free resources that you can use if you are interested in kind of like implementing different supports. So I would highly encourage you all to kind of go through that. So in that resource are some quality indicators, which I have listed here. And these are some quality indicators to think about when implementing mental health promotion activities and services. Now, by all means, this is not an exhaustive list, because schools are very creative in kind of implementing various mental health promotion programs as well as activities. So I'll give you a couple of seconds to kind of skim through this slide. But for this presentation, we'll kind of go through the common Tier 1 services and supports. So kind of the ones that I listed before: school climate, teacher and school staff well-being, positive behaviors and relationships, positive discipline practices, mental health literacy, and social emotional learning. All of the other indicators are being spoken about thoroughly on the original recording of this module through MHTTC. So again, I would highly encourage you all to kind of go back and refer to that. All right, let's move on. So the first quality indicator is school climate or positive school climate. So a positive school climate is related to student well-being and academic success. Research also indicates that it can improve attendance, achievement, retention, and graduation rates of our students. And most importantly, school climate measurement is the first step towards school improvement. So talking about overall school improvement. So by assessing school climate, or like perceptions that individuals have of their school climate. Educators and education agencies, what they can do is really identify key issues in terms of like school reform. And once these needs have been identified, all of this data from the school climate assessments can be used to kind of set goals, reassess goals and priorities, and choose various programmatic interventions that schools want to do if they want to enact these changes. This data gathered through the school climate assessments can also help identify where students, staff, and parents kind of view their school climate and kind of find similarities in perceptions or differences in perceptions. So according to the National Center on Safe Supportive Learning Environments, so this image here is actually, I picked it up off their website, and they use a safe supportive schools model, which you see right here. And this model helps assess school climates. So it contains 3 big domains. And under each domain, you see different subdomains or kind of like different components that make up that domain. So I'll give you a second to again skim through this slide. So when we speak about engagement, these are kind of the strong relationships and connections between not only students, but also educators and students, educators and educators, and also families, and also the broader community. It also includes respect for diversity and being equitable and inclusive. Then we have safety. So these kind of include environments and activities where students not only feel emotionally safe, but also feel physically safe. And for some common things that we see in schools are kind of bullying, violence, and substance abuse. So thinking about safety from those aspects. And then we have environment. So these are kind of like the program facilities, well-managed classrooms, and the available school-based mental and physical health supports. And on there, you also see discipline. And these kind of talk about having positive and also very fair discipline systems or disciplinary practices. So now this is kind of like a more practical question, right? So to what extent did your school or your school district use best practices to assess school climate? And this question kind of applies to schools that are already practicing or doing the work to assess school climate. But if schools are kind of still not there yet, that's okay. This is something that you can always learn from. So here are very briefly some best practices listed if you want to assess school climate. Now, I'll just give you again a second to go through, but I'll kind of like explain as you read through this. So you want to plan how data will be collected, stored, analyzed, and shared. So kind of after you decide what kind of school climate assessment you want to use, it's kind of like the screening data that we spoke about last week. You want to plan, you want to decide, and you want to see how are you going to gather that data? How are you going to store it? And most importantly, how are you going to analyze and share the results? Assess multiple dimensions. So you want to look at various aspects of school climate. So it can be student engagement, it can be student staff, student to student, staff to staff relationships. It can be school safety, it can be the learning environment. So it's always nice to get kind of different perspectives on different dimensions. Next one, obtain input from a variety of groups. So you want to try to include as many stakeholders in your school. So it can be students, it can be caregivers, instructional staff, non-instructional staff, and administrators are just some examples. Assess school climate using more than one modality for input. So a common way that we would assess are surveys, but we also want to consider other modalities such as interviews, focus groups, or school admin data like absenteeism, dropouts, graduation rates, and things of that sort. Allow anonymous input on surveys and other data collection methods. people tend to be more honest when, when our input is anonymous. So that's something to consider if you do kind of administer surveys. Of course, if it's focus groups, it may be a little bit hard to do that. But surveys is a good way if you want to collect anonymous data. Align the data collected with school's vision of school climate and improvement strategies. So once you do collect your data, you always want to make sure it kind of aligns with the vision that you have for your school. And also select evidence-based tools with strong psychometric properties. So whatever assessment that you do use to collect or assess your school climate, you want to make sure they are evidence-based tools. So the next indicator is teacher and staff well-being. So staff well-being is an important area of focus for mental health promotion. And like I mentioned before, school staff, actually educators and all staff are key players in the school community. We know that teachers experience high levels of stress and burnout, and these can often be tied to large class sizes, having too many students with significant, not only social, emotional concerns, but also academic and behavioral needs. So when these needs tend to be very high and school staff and educators have limited resources, that can really be conflicting and that can increase the burnout. So we want to also think about other factors such as physical space, high workload, low pay, tons of paperwork, we all know that, and high level of responsibility for student success. So statewide testing and those kind of stresses. So teachers who are stressed demonstrate more negative interactions with students. And these can kind of include greater sarcasm and aggression, and also responding negatively to mistakes. So if schools are already implementing best practices to assess teacher and staff well-being, that's great. But for schools who are yet to get there, these are some best practices that you can think of as you kind of plan to assess teacher and staff well-being. So I'll give you a minute to go through this. So as always, when we are going to assess school staff and teacher well-being, we want to establish a clear process and system for collecting the data, analyzing, storing, and also disseminating the data, because it's interesting for schools to share what kind of everyone's perspective is in terms of burnout and stress. Conduct well-being assessments with teachers and all school staff. So you don't want to isolate certain groups because all of us are kind of involved in the functioning of the school and functioning of our students. So you want to include all of your staff as well as teachers. When you do kind of assess well-being, you want to think about how frequently your school wants to assess this. So it could be annually, it could be twice a year, every semester. So it kind of really depends on kind of the resources that you have and where you want to start off. But starting once a year is always a good place. Ensure privacy of information and anonymity when assessing staff well-being. So again, the more anonymous your data collection methods are, or the responses are, the better response rates and high and more honest response rates that you're likely to receive. So you can also do surveys, but if you want to consider other methods, interviews and focus groups are also great ways to gather data. You also want to assess a range of well-being components. So talk about physical well-being, occupational, emotional, the in-school environment, social, and also intellectual well-being. And also, as always, when you do kind of select your tools to assess well-being, you want to make sure they are psychometrically sound and evidence-based tools. So listed here are some psychometrically sound tools, assessment tools that you can use. And these are freely accessible, so it can be obtained at no cost to you. And although there's a list here, I think the good thing is you can go through these and read and see what you feel best fits and suits your school and your school staff. So for schools who are already implementing some form of teacher and staff well-being, it's always nice to assess and reassess where you are with that kind of work and if there's space to improve. I'm a strong believer that there's always space to improve, so it's always nice to have that mindset. So one of the things you want to do is address organizational and individual factors that contribute to stress and wellness. So staff control and input, supervision and support for your staff, safety, and also supportive social and physical environment. So there's tons that you can, like the individual and organizational factors that you can think of. Some other examples are employee assistance programs, worksite screening programs, resources for employees, targeted resources for employees, stress management. So there's like a ton of not only organizational things, but also like individual things that that you can provide for your staff. You also want to make wellbeing resources and activities readily available to teachers and staff. The easy access teachers and staff have to these resources, the more likely they are going to be used. Integrate wellbeing activities into school culture instead of after-school activities. So this is kind of like a hard balance between like managing curriculum, but also providing these activities. But the more access to these activities during school hours than after school activities, I think that kind of is also indicative of teacher support or staff support, because it's been a long school day, and if teachers and staff have to kind of spend more time after their school hours to engage in this, it's very less likely to be seen as supportive. And also in some instances, it could be seen like as another task that they have to do. And also teachers and staff have families and they have things to do outside kind of the school hours. So we want to be considerate of those things too. The other one is make wellbeing activities available at no cost or low cost to teachers and staff. Okay. So the next one is positive behaviors and relationships. Now, a commonly implemented Tier 1 practice is setting school-wide expectations about positive behaviors. And when correctly implemented, school-wide expectations can promote a safe and supportive school environment where not only students and parents, but also staff understand and demonstrate that mutual respect and positive behaviors are an expectation of a school. So you want to think when you do implement this, when you do kind of decide on these expectations, you do want to think about settings. So kind of the physical layout of the school, how that's designed to support kind of the optimal functioning of staff and students. You want to think about routines, predictable kind of school-wide routines that can be developed and taught. You want to think about expectations. 3 to 5 positively stated expectations is a good place to start, but you want to make sure these expectations apply to both students and staff. All the rules are actually linked to these expectations, and also the rules are very clearly stated, they're posted, they're defined, but most importantly, they are being taught and not just being decided and put up on posters without kind of that explanation. You want to train staff to teach, like I mentioned before, you want to teach these expectations or the rules to students. You also want to tell them how rewards are developed, what kind of schedules that students will get rewarded, and how are these rewards delivered. So the more transparent that you can be with all of this, the better it will be when it comes to implementing these expectations. You also want to teach students how, so I think we often forget that we make these expectations and kids will ask you, well, why do we have to do that? I think it's always important to kind of teach students how these expectations or rules and even rewards, how are they decided, how are they developed, and how are they kind of delivered. So again, the more transparency, the better. And you also want to involve families and community members to develop and implement expectations about positive behaviors. So this kind of takes us all the way back to teaming, right? You have your school well-being teams. So these teams are like good places to kind of start talking about expectations. You have a big team, a multidisciplinary team. You have caregivers on that team. You have youth and students on that team. So these are always good people to include when kind of deciding on expectations. Okay, I'm just going to go back here for a second. All right. So to what extent did your school or district use best practices to implement school-wide positive reinforcement systems that promote positive behaviors? So previously we spoke about school-wide expectations, and this speaks about school-wide positive reinforcement systems. So once you do set expectations, now we want to implement these according to best practices. So a system of rewards is implemented. So you want to make sure you have a reward system, but that reward system, again, needs to be implemented consistently. And that is so important for kind of the effective functioning of it. It has to be consistent across, if it's across a classroom, then so be it. If it's across a campus, then so be it. So no matter kind of where you want to start with, you just need to make sure that you do implement it consistently. Supervision. So it's always nice to provide school staff with kind of reminders about, you know, the expectations and the delivery of rewards, kind of, as reminders, especially when it's something that's been done brand new. It takes time for people to learn it. So provide that piece of supervision in the form of reminders or active scans, and just observe your staff kind of interacting with students. The next one is opportunity. So you want to teach your school staff to provide students the opportunities to respond, because that's kind of one way to actively engage your students in earning rewards, and that kind of keeps reinforcing them to engage in more like positive expectations that you had laid out in the previous step. You want to acknowledge, so have your school staff use very specific praise and other strategies to communicate to students when they meet expectations. And always acknowledging continues to reinforce students to keep continuing that good behavior. Prompts and pre-corrections. You want to teach your staff to provide reminders to students. It's always like this means of constantly talking and delivering the expectation, so that it kind of becomes almost a road process. Error corrections. You want to teach your staff to use very brief, contingent, and specific statements when kind of like the negative behaviors occur. So rather than engaging in kind of like a back and forth argument, just be very brief, very consistent when you want to correct misbehavior. So some other strategies, again, you want to teach your staff how to avoid escalations. And again, kind of getting to that argument, you want to teach staff to minimize the accidental rewarding of a problem behavior. You want to teach your staff how to create learning opportunities and also kind of maintain optimal instructional time. And the last one here is discipline. So discipline processes are described in kind of a narrative format, right? And they're kind of depicted graphically. So you want discipline practices to include things like documentation procedures. So like, what are the steps that we're going to take in the event of a discipline concern? What are the problem behaviors that will kind of lead to an office referral? or a one-on-one discussion with a teacher, kind of. So you just want to be as clear as possible of how you'll address different disciplinary concerns. And one other important thing that to remember about discipline is we want to kind of have like a graduated array. So it's like a step-by-step array of responses to a disciplinary concern. So if a student for the first time misbehaves or has like a misbehavior, you don't want the first thing to be sending them to the office. You want to have like more less intensive steps. For example, talking with a teacher, talking with a peer, and then maybe give them like certain chances, and the last resort could be an office discipline referral. Okay, so the next one is positive discipline practices. I'll give you a minute to skim through this slide. Okay, so discipline always has this negative connotation, and that's why we add the word positive to it, right? So positive discipline practices. So while you try your best and hope that positive behavior practices will increase positive behaviors, we must not forget that our students are also children, and children are humans, which means that they will make mistakes. And in the event that they do, we want to have classroom and school-based strategies to kind of be proactive. In the sense, we want to be proactive to help build healthy relationships and also a sense of community in the event that there is conflict or there is wrongdoing. So restorative practices is one way that you can encourage positive discipline practices. So restorative practices, they promote more inclusiveness. They promote relationship building and also problem solving. And all of these are essential components to wellness and success of our students. We can also use informal and formal processes to proactively build relationships and also a sense of community in order to prevent conflict and prevent wrongdoing. The restorative circles and groups, they do provide opportunities for students to share feelings, build relationships, solve problems. And when there is wrongdoing, how do you play an active role in addressing the mistake or what has like the wrong that has happened? And how do you, on the other hand, make it right? How do you go back and try to redo things? So kind of teaching children, it's not the end of the world when you do a mistake. Like, there are other ways that we can make up for what has happened. And also we want to teach and model problem solving, conflict resolution, and conflict resolution in the classroom. So here are some very brief examples of strategies for restorative practices. So community conferencing, peer juries, where you have your peers involved in kind of the problem solving process, peer mediation, informal practices. So there are outcomes that it increases: school climate, positive school climate, how connected students feel to their school and to each other. It also increases parent and community engagement and academic achievement. So through restorative practices, you're not calling a parent the minute their child does something. You're trying to problem solve within the classroom as a group. And in that, trying to engage the parent and the parents and the community in problem solving and resolution. Okay. So to what extent did your school district or your school use best practices to promote or use discipline policies and practices aimed at reducing exclusionary responses? So one of the things you want to do is establish consistent expectations. I think this is so important because the more routines, the more consistent with expectations or rules or reinforcement systems, that really helps our students, and also it increases promotes positive school behaviors. You want to train and support your staff, not only in the expectations, rules, and how to implement the reward systems. You want to train your staff in emotional and behavioral health. And you want to make sure that this training is evidence-informed, it's culturally responsive, and they also learn about how do you de-escalate a crisis situation? What are some different techniques that you can use? So kind of like giving your educators the tools that they need to problem solve the immediate environments. You want to develop a multi-tiered system of emotional and behavioral health services and supports for students who may be at risk in their classroom for disruptive behaviors related to mental health concerns. You also want to use a process of graduated sanctions that limit or discourage, again, kind of like I told before, you want to have a series of graduated responses so that the first step of action is not going to be a suspension or is not going to be an office discipline referral. You want to have like a series of steps that are least intrusive and then kind of graduates to most intrusive. You want to examine the number of suspensions or expulsions by demographic groups. You want to see, this kind of helps you better understand any differences in kind of school policies and practices when it comes to kind of the suspensions and disciplinary actions taken against students. And the last one is you want to use restorative justice practices that focus on, again, repairing the harm caused by an incident and making sure students know that one mistake doesn't mean that it's the end for them. And just like, trying to be as restorative as possible to allow people to make mistakes and also teach them how to repair those and find a resolution. The last, actually one before the last, is mental health literacy. I'll give you a minute to read through the slide. So mental health literacy is the knowledge and beliefs about mental disorders, which help in their recognition, management, or prevention. And this understanding is so important because it supports in the promotion and maintenance of good mental health. So according to the authors here, mental health literacy has 4 components. It's obtaining and maintaining a positive mental health. It's understanding various mental disorders and their prescribed treatments. It's decreasing the stigma related to mental health disorders and also increasing or enhancing or encouraging individuals to seek help or increase or enhance help-seeking efficacy. So some strategies for schools to engage in to increase mental health literacy. These are very few that's listed here, but the implementation guidance has several others listed that will be helpful if you are considering to increase mental health literacy. So invite your local National Alliance on Mental Health. So you have local NAMIs everywhere. So invite them to come and give a presentation to students and teachers. They do offer presentations that kind of discuss warnings of mental health conditions, what steps to take if a loved one is showing symptoms of a mental health illness. So there are these presentations that can be very helpful, again, not only to students, but also your school staff. And these presentations can kind of be tailored for different audiences. So that's another helpful aspect. Collaborate with your state's mental health association to participate in campaigns for mental health awareness. So children's mental health awareness is a good place to start. So kind of be more community involved. Use teacher-delivered mental health curriculums. So the mental health in high school curriculum guide is a mental health curriculum that's specifically designed for teachers to implement in their classrooms. And that guide is freely accessible, and it also consists of different modules focused on understanding different aspects. So understanding mental health would be one. Understanding how to reduce stigma would be one. Help-seeking behaviors is another one. So let me quickly put this link to that. On here. Okay. It's called mentalhealthliteracy.org. And the last one is collaborate with organizations to help implement specific mental health literacy training programs or support programs in your school or even your district. One example is mental health first aid or youth mental health first aid. The youth mental health first aid actually provides training on how to identify, understand, and respond to signs of mental health illnesses and also substance use disorders. Okay, so the last indicator that we will cover in this section is social emotional learning. So this is the process through which children and adults understand and also manage emotions. They set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. Improvements in social emotional learning skills have been found to increase academic achievement, pro-social behaviors, social emotional skills, and positive self-image. It has also been found to decrease conduct problems, emotional distress, and substance use. So the core SEL competencies are listed here according to the CASEL module. So the SEL competencies include, so let's look at like the inner circle. So that's self-awareness, and this is where you know your strengths and limitations within kind of a well-grounded sense of self-confidence. Then you have self-management, where you effectively manage stress, control your impulses, and kind of motivate yourself to keep going, set goals, and achieve them. Then you have social awareness. This is the understanding of others' perspectives and learning to empathize with them. This also includes understanding and empathizing people from other backgrounds and other cultures. Then you have relationship skills. This is kind of learning to communicate clearly, listening well, cooperating with others, kind of resisting inappropriate social pressures, learning to negotiate conflict, and also seeking help, and also offering help when seeking help when you need it and offering help when others need it. And also responsible decision making. And these are making constructive choices about your personal behavior and your social interactions, and kind of like assessing ethical standards, safety, and also social norms. So kind of like assessing those and while also making responsible decisions. So to what extent did your school or district use best practices to support social emotional learning skill development for all students? If schools are yet to implement this, then this is a good place to start. But for schools who are, this is something to think about. So you want to know where to start, right? And one of the ways to go about this is to develop, again, a clear plan. What's your plan for assessing what the current or existing social emotional learning situation is like in your school? So think of this like baseline data, and this data really informs your team about how you want to improve in the future. So the next one is you want to, as a team with school staff, again, team can be school staff, community partners, parents, students. You want to gather this team and identify current activities or programs that support SEL skill development in your school. And you want to assess to what degree are these existing programs being implemented? And are they being implemented with fidelity? Are you achieving the desired outcomes that you first came up with when you planned this? So always reassessing frequently kind of helps you keep your goals on track and also improve as needed. You also want to collaborate with school staff, parents, and students to identify and adapt social emotional skill development practices or programs. And you want to do that to match the needs and also the strengths of your students. You also want to make sure that these are evidence-based resources, but also remember that this is not a one-size-fits-all. Your school has different needs, and that's why it's important to identify these needs before you decide which one you want to pick. Once you do decide and you implement, you want to monitor the implementation. You want to check for fidelity. You want to check for feasibility. Like, it's nice to have great plans, but sometimes when you try to implement them, they may not seem as feasible. And then, are they acceptable to school staff and students? Is this something realistic that a school staff can do? You want to ensure social emotional skill development activities are developed with and also communicated to your students. So trying to involve students, trying to involve parents and members of the community to develop and implement these are very helpful. Again, you want to reassess and continue to do that to monitor progress, to monitor fidelity and feasibility. So these, so that was the last component, but so I kind of went through the 6 commonly most implemented SEL tier 1 strategies in schools. But like I mentioned at the start of this presentation, there's a whole list of other services and supports that schools can implement. For one last time, I'm actually going to put the link to the recording of the full recording of this session. So that way you can continue to listen to it and see what the presenters have to say about the other remaining tier 1 services and supports. So that kind of brings us to the end of mental health promotion or tier 1 services and supports webinar. Again, I did not cover everything, but please go back to the link and watch the full recording. And you can also find it on the MHTTC website. We do have 3 more webinars that we will cover to complete this series. Please do join us next month, the 2nd of March at 10 a.m., at 9 a.m. For our next webinar, which is early intervention and treatment. So we'll kind of cover tier 2 and tier 3 supports. So until then, thank you for joining us today. If there's any information or any questions, I'm happy to answer them. This is my contact information. So yeah, thanks for joining, and we'll see you next month.